Hello guys, good afternoon. This is Miss Henderson. Thank you again for tuning into my channel. Welcome if you're new. If you're new, please subscribe to my YouTube channel, like and share this video, and drop your comments below and give me a thumbs up. So today I am coming to you with some BLS test questions. So these questions are from the American Heart Association for the BLS course. So I am going to review a few questions with you, and if you like these types of video, please consider subscribing to my YouTube channel, like and share. So let's dive into the video. So I am going to be reading from my template. I have a template with questions. So I will be looking down and reading from the template. So let's go. So the first question I have is, what is the recommended depth of chest compressions for an adult victim? Answer, at least 1 inch or 2.5 centimeters. B, at least 2 inches or 5 centimeters. C, at least 2 inches or 7.5 centimeters. D, or at least 4 inches and 10 centimeters. So the correct answer for this question will be at least 2 inches, which is equal to 5 centimeters. So you want to make sure you really compressing. By compressing the chest to its appropriate depth, you are enhancing blood supply to the brain, and therefore you are increasing the patient's survival rate. So let's look at another question. So what is the compression ventilation ratio for one rescuer adult CPR? So how many compressions will you provide if you are one rescuer on the scene? So the correct answer for this question is 30 to 2. That's the ratio. 30 to 2. You'll be giving 30 compressions and you're going to be giving 2 breaths after the 30 compressions. And how many cycles are you giving? You're giving 5 cycles. 30 compressions, 2 breaths. 30 compressions, 2 breaths, 30 compressions, 2 breaths, so on and so forth. So that's the appropriate ratio. Let's look at another question. What is the recommended rate for performing chest compressions for victims of all ages? So now this question is asking you the rate. A, at least 40 compressions per minute. B, at least 60 compressions per minute. C, at least 80 compressions per minute. D, at least 100 compressions per minute. So the correct answer for this question will be at least 100 compressions per minute. That's the rate, and that's the correct answer for that question. Let's look at another question here. I hope you like this video. These questions are meant to help you to pass the BLS course, because some of the questions, some students I find have difficulties in choosing the correct answer. So I said, why not come up with some tips and tricks that can actually help the students to pass their BLS certification class. So I have another question here. What is the compression ventilation ratio for 2 rescuer infant CPR? So this question is about an infant. Answer A, 5 to 1. B, 15 to 2. C, 20 to 2. D, 30 to 2. So the correct answer for this question will be 15 to 2. If you have 2 rescuers on the scene, the ratio is different. It's 15 to 2. So one rescuer will be giving the compressions. The second rescuer will be positioning at the head to give the ventilations, the breaths. So the correct answer to that question is 15 to 2 for an infant when there are 2 rescuers on the scene. Let's look at another question. What should you observe when trying to determine if rescue breaths for an infant victim are effective? A, visible rise of the stomach with each rescue breath. B, visible rise of the chest with each rescue breath. C, complete compressions of the ventilation bag. D, air leaking around the ventilation mask. So what do you think is the correct answer to this question? So the correct answer is visible rise of the stomach with each rescue breath. No. B, visible rise of the chest with each rescue breath. So B is the correct answer, because as you're giving the compressions and you're using either the Ambu-Bag or the packet mask to give the breaths, you will see visible rise of the chest. So visible rise of the chest, that will validate that your breaths are effective. Because sometimes if you don't create a seal around the patient's mouth and you give the breath, sometimes the air leaks around, and that can prevent the air from getting in. So you want to make sure you create a very tight seal. If you're giving the breaths and you don't see rise and fall of the chest, then you're going to have to reposition the mask and try to attempt to give the breaths again. That's the answer for that question. Visible rise of the chest with each rescue breaths. Let's look at another question. What is the compression ventilation ratio for 2 rescuer child? A, 15 to 1, B, 15 to 2, C, 20 to 2, D, 30 to 2. So the correct answer for that question is 15 to 2. Okay, let's look at another question. What should you do when administering breaths by using a bag mask device for a child who is not breathing but does have a pulse? A, give breaths at the rate of 1 breath every 3 to 5 seconds. B, position the child on his or her stomach. C, squeeze the bag as often as possible. D, avoid performing a head tilt. So the correct answer for this question is A, give breath at a rate of 1 breath every 3 to 5 seconds. So that's the answer for that question. So guys, these are few questions for the BLS recertification course. I hope you like this short video. If you do, please subscribe to my YouTube channel, and please leave your comments, drop your comments below this video, and let me know what else you would like me to come up with. I come every so often with different educational topics to help nursing students and nurses to deepen their understanding. And thank you so much for my subscriber that has been subscribing to my YouTube channel. Thank you so much. I really appreciate your support, and this channel can really, you know, grow if I get more support from the audience, my targeted audience. Thank you so much, and enjoy the rest of your day. Please subscribe. Thanks. See you in the next video. Ciao.